The Public Health Institute is a freestanding nonprofit, and it's dedicated to promoting health, well-being, and quality of life in California, around the nation, and across the globe. We engage in research, we implement programs, and we're also actively involved in policy development. We do our work in partnership with government, with other nonprofits and academic centers, and we have staff who are doing this around the world.
Now, there are fears that the coronavirus outbreak could become a pandemic. We now know there are confirmed cases in 35 countries.
He is on the front lines here in the U.S. response to the coronavirus outbreak. Dr. Fauci, good morning. It's good to have your time, sir.
It was leadership and making sure that we were able to provide leadership where there was a huge gap. One of the things that we did is we came up with a model for contact tracing. We ended up implementing in May in Oregon and Washington, and we're just now beginning to do that work in California. And we found some great partners to work with. A number of foundations in California have come together and created a pooled fund so that we can work closely with community-based organizations to rapidly meet the needs of the high-impact communities. And similarly, we're in partnership with Kaiser Permanente to help do contact tracing with safety net providers and Kaiser in high-impact communities.
I was looking for a job, and I was looking for an opportunity to continue working in my community. And the partnership with the Public Health Institute, Kaiser, allowed me to further expand my knowledge in public health. And at this moment, I'm still signing up for more classes. Being at the front lines is so extraordinary. We get to really understand what's happening with people in our communities.
Contact tracing is, at its core, about trust. What we try to do is really impart that we have no judgment. We just really want to help people. People of color, Black and brown people, are disproportionately affected by coronavirus. We actually built up a program that is multilingual, multicultural. We were able to get a lot of people that were already working in the community apply for these important roles.
Right now, we can make sure that communities are getting the resources that they need for the short-term interventions and also to build resilience over time. One of our programs developed something called the Healthy Places Index. The state used that as the basis for some of their allocation decisions, and now the state has developed an equity metric that is unique across the nation in guiding resources to those who are in the greatest need. Multi-generational housing, barriers to affordable health care, greater exposure through employment was really disproportionately affecting a lot of communities. And so we've been taking a look at how we can both lift that up and embed it in our various programs. One of the things we realized is putting public opinion pieces out on some of the policies that were going on to support the evidence-based approach of local public health leaders who were getting death threats, who were being challenged for following a science base. And we also tried to support CDC and other top public health institutions to bolster that their decisions continue to be evidence-based as they always have. We wrote letters to legislators and decision makers, around issues like herd immunity and testing guidance that was being called into question. And we kept the drumbeat up for science and research.